cabinet being tested. At this time, most international conferences have been cancelled or postponed, and thus there has been a fairly insignificant travel, even from a department such as ours, which has a lot of international commitments. There's a significant reduction with respect to international meetings. The visa issue, I think Ms. Naledi will speak to it, but I don't think there's a focus on persons who are already in South Africa, except with respect to the past 20 days, but we'll rely on him to respond on that. There was one question which we'd left out, and that was with respect to China. Clearly China has made commendable progress through the steps taken by the leadership of the People's Republic of China. Nevertheless, as the government has indicated, in China the situation is not totally clear, hence this reference to high risk. Will South Africa go exactly the same route? No, it's not going the route as proposed. We do not have a particular area that is an epicenter, hence the measures that are proposed are of general application in the country, but we do recognize the immense steps and the success and achievements that the People's Republic of China has recorded. With respect to students, one of the difficulties that we have confronted, and perhaps Minister Nzimande will also speak to this, is that many South Africans abroad do not register their presence in the current country at our missions. We've been appealing to all South Africans overseas to approach their local mission and to register, so that if there is a need for assistance, we know how to reach them, and we are able to assist when necessary. The key action at the moment, should you be in an area which is high risk, is to follow the prescripts that those governments have issued, which is self-isolation, and to seek medical assistance if one feels by any means that they may be infected or are exhibiting the symptoms associated with COVID-19. We haven't put any plan in place for any further evacuation at this time, but as I've said, each matter is dealt with in terms of each different situation. And for me, my request is for those who are outside our country, we have put together a command team working through our consular services. We are ready to provide assistance where required, but we need to know who you are, where we can contact you, etc., etc. So we are appealing that you assist us in this regard. With respect to places of worship, and particularly with congregation at mosques in our country, the colleagues who posed the question would know that countries other than ourselves have taken measures with respect to mass gatherings and have limited numbers. We could cite Iran, Iraq, many Muslim countries have had to take such steps. We are appealing to us as the public to be the ones who respond to assisting our country not to have a spread. We know that the spread occurs through human contact, and whatever can be done to assist South Africa to limit spread of this particular epidemic, let us do it. It's really an appeal to our people. We don't wish at any point to be calling out anyone to enforce mass separation. So I think we call on every institution, on all religious leaders, and this will be repeated in the deliberations on Thursday. But the key issue is all of us can act, and there's no malintention by the government. And I believe that the Ummah, our Muslim community, is able to respond when they're aware that there is a crisis confronting our country. And we expect that kind of response from each of the religious groupings in South Africa. Thank you very much, Mr. Mtini.
Minister Patel.
Thank you.